Guys, welcome back to my channel. It's Ejeomah again. If you're new here and you don't know who is talking, my name is Ejeomah and I make lifestyle content video, and my goal is to help young professionals like myself navigate their way here in Nigeria, especially in Abuja. If you've ever wondered, oh, what is it like to work in a community pharmacy, or what is it like to work in a hospital pharmacy, this video is for you. Although I haven't formally worked in a community pharmacy, but I have colleagues who have, so I'm going to be using, based on what I've heard and what I've seen, to go into the topic today. Okay, are you ready? Yes. So we're going to be making a comparison between community pharmacy and hospital pharmacy. Is that okay? So we're going to be starting with 1, career progression. If you watched my last video, you understand that in hospital setting there is always a career progression. You move from one level to another after having attained some years and experience in a certain level. You write another exam for another level. So if you watch my video, I explain how you move the grade level. Okay, if you haven't seen that video, check in my description box below and you can watch all the pharmacy content there. Whereas in community pharmacy, it's not the same. Okay, in community pharmacy you get to just be a pharmacist, all right, and a general manager. I think that's just the highest you can go. A pharmacist, a general manager. Which leads me to my next point, which is salary. So the higher you go in hospital pharmacy, the higher your salary. The more you progress, the more your salary. So from one level to another, it's the more, after some years your salary increases. When you move to the next level, your salary increases. So, but in a community pharmacy, you just have the pharmacist and the general manager, who maybe gets something more than the pharmacist. The next point is rotation. Okay, rotation. In hospital setting, you get to rotate different wards. So far now, I have been in the outpatient unit, the STC department unit, compounding section, and now I'm currently in the NHIS. So you have these different units, and with these different units you get exposed to a different environment. You get to learn more things, whereas in the community pharmacy it's just this big pharmacy with the drugs and the medications there. In hospital setting is more detailed. Okay, you rotate from this pharmacy to another, from this pharmacy to another. But I think after internship, because I'm talking based on internship, after internship I think you might be taken to a particular unit and you might not necessarily rotate till maybe after 2 years they decide to rotate pharmacists to another department. But as an intern pharmacist, I get to work in different wards. We are going to talk about knowledge. Generally, in hospital setting, you're supposed to know more. But what I've noticed in the case is, in Nigeria, you actually get to know more if it's a teaching hospital, okay? But if it's a regular hospital, you might get to know, but I don't think you know more. When I mean know more, in hospital setting, you are exposed more to clinical knowledge. You get to, okay, what's the cause of this, how did this happen, this, and you get access to files of the patients. And if you get to get around during ward rounds, you can also get into the files of the patients and all that, and you get to know a detailed how the disease progressed in this particular patient, that, and you can have a clear understanding of the clinical aspect of it. While in community pharmacy, you don't get that opportunity, okay? But what I have noticed is, in community pharmacy, I'm comparing it with my own experience, okay, in hospital pharmacy. In community pharmacy, you get to get exposed to a lot of brand names of drugs. So let's get to the next point. That is physical. In this aspect, right, what I've heard from from community pharmacists. Like I had this colleague that came to the hospital, and she was like, oh, lamenting how she was like, really, they don't get to sit in the pharmacy. Like, she worked in a community pharmacy, they don't get to sit, they stand like throughout, they stand for long hours. And she's like, oh, we are very lucky, right? Because in hospital sets, you sit 80% of the time. 80% you're just on the computer, costing the drugs, like just administering to patients just from your seat. Yes, let's talk about access. In community pharmacy, you get, when I talk about access, I'm talking about them, like you getting access to money. I don't like to have anything to do with all those other aspects of it, you know. So we just cost the drugs, we send the patients. So I don't know about other hospitals if it operates that way. Then we send the patient to pay, and then we dispense the drugs. But in community pharmacy is different. You get direct access. Maybe other pharmacies, maybe not every community pharmacy, but for most community pharmacy in Nigeria, you get access to patient giving you the money, like you give them the change and all that, blah 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 blah. So that's one thing. Like, it's not really a problem, but I mean, like, for me, I just find it very. Let's talk about teamwork. In hospital setting, you know, you are not working alone. You have doctors, nurses, to enable that they adhere and comply with the medications that you're giving to them. So in most cases, right, you know, in a community pharmacy, someone can just walk in and say, okay, I have my back aches, can you get me something? But in the hospital, you cannot dispense a drug without a prescription. There has to be a prescription. You cannot just give, like, that's how it works. I don't know in other hospitals, but like I said, I'm using the way I work in, for instance. You cannot just dispense. It has to be in a prescription. There has to be a doctor writing a prescription before it gets to you. So a patient cannot just walk directly to you. Whereas in a community pharmacy, the pharmacists are lords there, you know. Someone can just walk in and say, oh, my head, oh, it's my hand, this and that. Like, okay, what do I need to do, and that and that. So in community pharmacy, pharmacists get to be their own bosses, and like they're doing their stuff. But in hospital pharmacy, you still need to, like, even when you feel like, okay, the medication, this doesn't look right, and maybe the dosage is more than it's supposed to, you still have to go back to the doctor and ask and be like, okay, you know, politely, and those kind of stuff. And oh, can we, is there a reason why this is like this, in a cool, calm way? And even at that, there's still some doctors that'll be like, oh, like they don't want to agree and those circumstances. But then at the end of the day, that's how it works. So let's talk about environment in hospital setting, right? This is one thing that made me not, at first I was so reluctant, because I don't like hospital smells, and I don't like pharmacy smell too, because like when you walk into a pharmacy, you can, like, it's like you perceive like these different drugs together, the mixture of everything is just like oof. But the hospital one is like worse. Like, I would pick a pharmacy over a hospital, because hospital you're exposed to like different smells, like maybe fresh cuts, wounds. Community pharmacy is like there is no smell. It's just like just the drug combination, but the other one is just like, yeah. Last but not the least, let's talk about flexibility. According to some of my colleagues that worked in community pharmacy, they usually say they don't have any time to rest, so they work every day for a month. Whereas in the hospital setting, you can get a certain number of duties in a month. But I don't know, I don't really think I see the difference, because now let's talk about hours, right? In community pharmacy, most community pharmacies operate like 12 hourly, not like 24 hours. So you get to do like morning duties every day for a month, right? While in hospital setting, you could do night calls. You would do, like, you'll be on call, like you would do night shifts, morning shifts, night shifts. So at the end of the day, I don't know what's different, if there's a difference, but there's actually a difference, because see, guess if you have to work every day, like right now I'm at home because I was on nights, I was on call till this morning. So I came in this morning, and today just would be my free day since I was on call yesterday. So yeah, that's the difference. So I think hospital is more flexible when it comes to that, while community pharmacy is not, right? So that's all when it comes to working in a community pharmacy I'm working in a hospital pharmacy. If you're wondering like, okay, which one would I prefer, you can do the two and see the one that you can eventually fall in love with, because you can take, like for instance, there's some people that work in hospital pharmacy and then in the weekends or when they are free they do like local in the community pharmacy. All right, see you in another video. Make sure to subscribe and share this with your friends. Okay, until next time, bye bye.